In height lengthening surgeries, there are three principles we never compromise on. This is a cosmetic procedure. One of the most important rules I never compromise on is planning the lengthening without disrupting the patient's natural body proportions. In other words, we aim to increase height while preserving proper body proportion. Some patients request a single surgery to gain 10 or even 11 centimeters in height. However, in general, I recommend a maximum lengthening of 7 to 8 centimeters. Because after 7 to 8 centimeters, body proportions and overall appearance inevitably become distorted. And since this is a cosmetic procedure, the patient may not notice this in the early period or perceive it as a mental concern at first. But eventually, since their body will inevitably change, they start to or will start to have problems with it. That's why I want patients to strictly adhere to these limits. If they won't adhere to these limits, they must sign a written consent form stating, "The doctor informed me of this, but I am continuing it of my own free will." Another thing I never compromise on is that patients should not have requests that would harm their health, meaning if they're not suitable for surgery, it's not a case of, "I absolutely want it." So, if someone is on medication that would impair chronic bone healing, if they have a cardiac problem or a condition that even anesthesia considers medium risk, I absolutely do not recommend or perform surgery on them, and I do not want any pressure to be put on me regarding this. Because a cosmetic operation is not a life-threatening procedure or a surgery that is absolutely necessary. If the patient is in good health and genuinely desires this and is willing to accept all the associated risks, then I wish to explain everything thoroughly and assist them in the best possible way. However, if patients have requests that could potentially jeopardize their health, or if they don't take these matters seriously, I will not compromise on such demands, and I absolutely will not perform or recommend them. Another unwavering principle I adhere to is that if patients dislike engaging in rehabilitation and are unwilling to accept the extended duration of the recovery process, and if they are not psychologically prepared or suitable for this particular surgery, then I absolutely do not perform or even suggest this operation to such individuals. I simply tell them to go wherever they truly wish to be.